I think I might start with the presentation. Seems like we don't have any last people right now, but there may be people that join us. But thank you so much for connecting with us this evening. We're really excited to be able to talk to you about the Masters of Psychotherapy program offered at McMaster University. I will orient you, we have some of our faculty members as well as students and our administrative support here with us tonight. So they may help to answer some questions that you have as we talk about the program and when we open it up to the questions at the end. So we have Susan Vaughn, who is our program administrator, here to kick with us tonight, as well as Jennifer Krall, who helps providing administrative support. Laura O'Neill, who is one of our key faculty members and teaches many of our first year courses as well as second year. And then we have Navia and Prabnar, who are two current students in our program, and they're in our second year. So they're just in their sort of final year in the program and getting ready to think about applying for the college and their next steps, so they can answer questions and they'll speak to you about their experiences in the program so far. So if you have any questions directed towards them, they're also available to answer those questions. So again, thank you so much for taking the time to connect with us this evening. And I hope over the presentation we'll be able to answer and provide some clarity about the program, as well as some of our admissions requirements. As you may know, our application is now open and will close at the end of November. So hopefully we can answer those questions. I will also let you know we are having another open house next Tuesday, so October 26th. That's offered through the Faculty of Health Science. That is another kind of drop-in seminar. So they're using a special kind of platform where you can pop in to our booth, ask us whatever questions that you have, and then hop out. So it's another opportunity to connect with us if we aren't able to answer the questions that you may post tonight. So we'll try our best to answer as many as you can. And before I start the presentation, I'll also introduce myself. So my name is Elizabeth Pollock, and I'm the director of the Masters of Science program. So I'm very excited to speak with you about the program today. So as you may know, the program is relatively new. We have just admitted our second cohort, so they started in September. And we're very excited to sort of plan for the next September and to think about admitting our third cohort. So we're relatively new, but in some ways it's nice to be in a program that is just getting launched, because you may hear from Navi and Prabnar that we are very open to hearing student feedback and to sort of think about any ways that the program can be modified to make sure that we're meeting the students' needs. Okay, so a little more about the program. So just some context for you to be aware of. So as I mentioned, Susan Vaughn's our program administrator. So if you have questions about the program or about the application, you can direct those to our psychotherapy email, so psychother@mcmaster.ca. I'll let you know Susan is getting many emails, so unfortunately we're not able to respond to everybody's questions about their specific application, but if you have general questions, we definitely can respond to you about those, but unfortunately we can't talk about sort of specific questions you have about your application until we start to review applications. We also have a student ambassador through the Faculty of Health Science, so this is another contact person. Should you have any questions about a student's experience in the program, you can direct it towards Andrea, and then myself, Elizabeth Pollock, as the director of the program. So just a little bit of an overview about the program. So I imagine many of you have looked through our website, but sometimes it's not always clear. So I want to just orient you to what's involved in this program. So the Masters of Psychotherapy program is a professional course-based degree. So this means that there is no research component required. So it is not a thesis program. It is primarily course-based, meaning that you take and complete courses and receive didactic as well as experiential training to complete your degree. In the program, there are the courses start more introductory, so to make sure that everybody's starting off with the same level of knowledge in terms of introductory information into mental health as well as psychotherapy. And as the courses go on throughout the program, the content also becomes more advanced and more specific. So really the goal is throughout the course of the program that you get a good foundational knowledge in mental health and psychotherapy, and then as the program advances, you become more specialized. The primary focus of this program is teaching people cognitive behavioral therapy. So that is a form of psychotherapy. That is the main orientation that we focus on in our program. But you will get some exposure to other types of psychotherapy, just not the same in-depth training. So should you want to go on and receive additional training in those psychotherapies, we can direct you to those resources, but they are not a component of our program. In the program, there's 7 required courses, so every student takes the same 7 courses, and then we have 2 elective courses that you can complete. So we have different electives ongoing throughout the years, and you get to choose which of those electives you may be interested in, and I'll touch on a few of those electives later on. And then students also, a part of their degree, have to complete 2 clinical practicum. And I'll orient you later to what that includes. So, but 2 practicum, which might be at the same site or different sites. So those are the main components of the program. So as I mentioned, again, there's no thesis or research requirement or major capstone project, but really it's the completion of the courses as well as the clinical practicum that make up the degree requirements. We enroll approximately 20 students a year. Next year, we may have a bit larger of a cohort, but we aim for around 20 students. The program is a full-time program, so meaning that you're required to be available to the program full-time. So when the courses are scheduled, they're scheduled during the day. The practicum are completed during the day, during working hours. We have other components that you're required to attend. So for example, we have speaker series that are sort of lunchtime seminars that are also a required component of the program. The program is 5 terms, so it's just under 2 years, so really 20 months in total, and I'll show you a timeline of the program in a few minutes. And the class format. So as you know, or may know, the program launched amidst COVID. And so we really had to transition the program to all being online. So up until now, all of our courses have been run virtually via Zoom. And I'm curious to hear about Navia and Prabnor's experiences with that. I think, ideally we would love to see everyone in person, and I think there is something about being in person and being able to be in the classroom together. But from what I've heard from the instructors and the students, it's actually worked okay. It's been an okay experience, and so I think I'll be curious to hear about how they describe that as well. We are hopeful that come next fall that maybe our classes can be in person. The university is starting to think about that transition. So how do we get back to in classroom in a safe way? And so, that is our hope if we can get there. Potentially, we may have a bit of a hybrid model where some classes are virtual and some are in person, but we just don't know yet. Lots of that's still in the work, as you may imagine. Another thing to think about this program is it's sort of held at a unique place. So the program itself is not held on McMaster campus, but we are affiliated with, we're in the Department of Psychiatry and Behavioral Neurosciences, which is actually situated at St. Joe's Healthcare, so St. Joseph's Healthcare, which is at the West 5th campus. So if any of you are familiar with that, it's a kind of mental health institution site for St. Joe's. And so the psychiatry department is actually on the 3rd floor of that program, and we have space on the 2nd floor of the hospital. And then, there's many clinics, mental health clinics within that site. So the anxiety disorders program, the mood disorders, for example, and some of our students are there right now doing practicum. So we're in a bit of a unique site in the sense that we're actually held within the hospital. So that's just something to be aware of also, is that if we are in class in person for the that fall, the classes would be held at West 5th, not on McMaster campus. Instructors in our program are members of the Department of Psychiatry and Behavioral Neurosciences, and they come from a range of disciplines. So we have psychotherapists, social workers, psychologists, as well as psychiatrists that participate in our program and provide training. So I'll give just an overview now of the program timeline. So as I mentioned, the program is 5 terms in duration. So the first year runs from September to August. So we do run in the summer term. And then the second year runs from September to April. So you would finish the program just before the summer term. In the first year, students complete 3 required courses. So the Introduction to Mental Health and Wellness, Principles of Evidence-Based Psychotherapy, and an Assessment and Case Formulation course. So all 3 courses are required and are completed in that first term. And we design the program in a way that you really, again, develop those foundational knowledge in mental health and psychotherapy to get you started with the program. And then again, your knowledge becomes more advanced as you advance in the program. So our second term, we run our cognitive behavioral therapy course, which again provides in-depth training into what is CBT, what are the components of CBT, what do the protocols look like for different disorders, for example. We also have the ethical standards and professional practice course. And then in that second term, many students take an elective. So electives can be taken in any term, but we do encourage them in some terms as there's a lighter course load for the required courses. In the third term, which is the summer term, students complete their first practicum. This is a 4-day per week practicum. So it's almost like a full-time job for that summer. So it runs from May to August. And again, students are at a variety of different practicum sites, which we can talk about later. But it is really, we've designed that first practicum to be primarily observational and depending really where to meet the students' needs. So if you do come to the program with experience providing psychotherapy to some degree or having some psychotherapy experience, then you may be able to engage more in that practicum, but we do offer it almost more as an observational, starting to sort of understand, observe psychotherapy before you do your second practicum, which would be then more applied. Into the fall that year, there's 2 required courses. So the clinical research methods course, as well as the applied psychotherapy skills course. This course is providing different psychotherapy skills in a more experiential way. So meeting with your cohort, you're on practicum at that time, talking about different types of psychotherapy skills. We brought in simulated patients to that course so that you could role play with a simulated patient, providing a certain type of skill, practicing interview skills, for example. So we want it to be a very hands-on course to provide you with specific training in different types of psychotherapy skills. So at that time, you're also completing a practicum, and this one is more longer term, but fewer days per week. So completing a 2-day per week practicum, but for 8 months. And so in that way, you get really an in-depth experience at that one practicum site that you're at. You potentially get to see kind of multiple rounds of group therapy or see multiple patients throughout that practicum. Again, that practicum for some of our students is conducted at the same site that they did their first practicum. So, they may have taken a more observational approach for their first practicum. And then for their second practicum, they now feel more confident, ready to start seeing their own individual patients, ready to start taking more of an active role in the group therapies that they might be participating in. So it's kind of a nice transition and an ability to start applying some of the skills that they've learned. And then in the final term, there's an elective course that students can take as well. That's Applied Psychotherapy Skills is a 6-unit course, so it actually runs a full 8 months as well. So we designed that to be running at the same time that students were in practicum, so that they could bring some of their practicum cases to that course, or bring some questions about certain skills that they want to learn. And it can be very experiential learning in that course. In terms of some of our electives, electives that we've had running in the last few years include a mindfulness-based cognitive therapy course, an acceptance and commitment therapy course, interpersonal therapy course, and we are also doing a motivational interviewing and a course. So we have quite a few different electives running, and those again are courses that provide more in-depth training into a specific form of psychotherapy that students may not have had exposure to in their other courses. Okay. So I'm going to transition now and talk a little bit about why. Why might you take this program? Where is it going to lead you? So I imagine many of you are coming in with sort of thoughts about interest in going on to provide people with psychotherapy, or interest in working as a psychotherapist in the future. So that is definitely one avenue that you may pursue after completing this program. So a registered psychotherapist is somebody who provides psychotherapy to individuals with the goal of helping them to improve or maintain their mental health and well-being. And with a client as an active participant, or an RP works towards bringing about change in that client's thinking, feeling, behavior, social functioning, and with the idea of really improving certain areas of life that might be negatively affected by mental health concerns or other problematic behaviors in their daily life. So it is, many of our students probably have the goal of going on and becoming a registered psychotherapist. And that's really a profession that is a bit, in some ways, unique to Ontario with the new College of Registered Psychotherapists. But there are many psychotherapists or potentially counselors. The title may be different across other provinces, but this program is really designed to give people, again, foundational knowledge in mental health, and some foundational knowledge and skill in providing psychotherapy, and specifically cognitive behavioral therapy. So just a little bit about psychotherapy in Ontario and why we ultimately went on to design and establish this program. So in Ontario, psychotherapy is a controlled act, meaning that only people who belong to certain professions, regulated professions, are able to perform the controlled act of psychotherapy. So this really became into effect in about, I want to say 2014. I'm forgetting the exact date, 2014 or 2015. The psychotherapy became a controlled act. And under that change, the College of Registered Psychotherapists also became more established. And so the term registered psychotherapist then also became a controlled term. So only people who are registered through the College of Registered Psychotherapists of Ontario can call themselves a psychotherapist. In addition, social workers, nurses, physicians, occupational therapists, and psychologists can also perform the controlled act of psychotherapy. So in Ontario, it is a regulated profession. In different provinces, there are different regulatory bodies. So I'm really speaking here specific to Ontario. So again, to be a registered psychotherapist in Ontario, you have to be a member of the Regulatory College, so the College of Registered Psychotherapists of Ontario. Now, to think about the college, really the CRPO holds all registered psychotherapists accountable for their conduct and practice. So really the goal for them is to protect the public and not the therapist. So really it is about ensuring that psychotherapists are providing, that they have competency and are providing appropriate care. So one thing I will say is that all programs in Ontario we're not designed to necessarily ensure your registration with the college. So the college is a completely separate entity from our program, but we provide the knowledge that may provide someone with the foundation that they need to go on to become a registered psychotherapist. So that's just one thing to be aware of. Completing this program does not guarantee registration with the college. Okay. Okay, so, thinking about if that ultimately is your goal, though, to go on and become a registered psychotherapist, many psychotherapists work in different areas. So, and you'll see that many of our students are doing practicum as well in these different types of sites. So psychotherapists may work in hospitals, may work in university counseling centers, for community agencies, in family health teams, working in addiction rehab programs, may work for an employment assistance program, or there are many psychotherapists also working in private practice. And we do actually have some practicum students right now who are working in private practices, as well as at hospital sites. And we're working towards developing relationships with universities in the area to also provide those as practicum sites. Okay, so I'm going to transition now and talk about our program specifically and our admissions requirements. So as I noted, our application is open now, and we will be closing that application November 30th, which means that all requirements of that application must be in by November 30th to be reviewed by our admissions committee. So admission requirements include an honors degree in psychology, social sciences, or health sciences. And when we first were designing this program, we were sort of thinking more broadly about who may be admitted to the program. And then we became to realize that there are really foundational courses that are important, or certain types of training that are important to set a student up for success in this program. And so that's why we have narrowed the scope of who is eligible to be admitted to the program, and having some foundational training in psychology, social sciences, or health sciences has really been an advantage to our students. It does provide them with that foundational training that we just can't also provide in this program. We do require a minimum of a B+ average in the final year of study when you're applying for the program. I will say it's become quite competitive in our program. So last year we had over 300 applicants to the program. And so unfortunately, sometimes meeting these requirements at the minimum doesn't necessarily guarantee admission to our program. For students where English is not your first language and you didn't go to an English-speaking undergrad university, we do require an English test of proficiency. Included in your application, we asked for a couple other things. So in addition to, just having completed those background educational requirements, we do ask that all students submit a CV. And this is really the time for you to describe your past experiences. So what your past education experiences have been, your past volunteer experiences, work experiences, or any research experience. And I do encourage you, as much as you're able, to really describe what those experiences entailed. So if you volunteered at a community agency, for example, what did you do there? What was involved? What was the skills that you learned? If you worked for a research lab, what was the study you were engaging in? What were your responsibilities? Adding those details is really helpful for us to get a sense of what type of experience that was and what have you learned there. So more than just sort of, sometimes people submit more of a resume where it just says what the title of their job was and not any details. And unfortunately, that doesn't provide us with very much information. So if with your CV, enclosing information about what your responsibilities were is very helpful. We also ask that you write a personal statement. And in this personal statement, we really want to hear about why are you wanting to join the program? So what led you to be interested in joining the program, and how have your past work or volunteer experiences contributed to your sort of knowledge that you're bringing to the program? So how will they maybe advance you in our program? We also ask that you submit 2 letters of reference. Ideally, these letters come from academic references. So, if you completed a thesis, having your thesis supervisor write a letter for you, or a course instructor who got to know you fairly well, or somebody that you volunteered for and was a supervisor. Those are really the sort of ideal type of reference in this situation. And then we ask that you submit all of your transcripts. We do ask that you upload unofficial transcripts to that application. And that's very helpful right now because unfortunately, sometimes transcripts get lost in university mail. We struggle finding some. So we ultimately get them, but just to help with our review process so we don't get delayed in reviewing your application, we encourage you to all upload unofficial copies of your transcripts as well. So if you don't meet those admission requirements, let's say, you completed a degree many years ago, you've been working in a different field or a similar field, and you're wanting to come back to get additional education, we do have a set of alternative admission requirements. So if you have a 4-year undergrad degree or something that's been completed more than 4 years ago, you would include any coursework that you've taken since that time. And then you would talk about work experience that's relevant to the master's program. So we would look there at work experiences as really a foundational training that you've received beyond your undergraduate program. And there we would ask for at least 2 professional references if you've been working. And then it would require the same additional components of the CV and your letter of intent, as well as all of unofficial transcripts. So once all of our applications are in, so beyond November 30th, we then in our program have the goal of looking through all of those applications. So we don't start that review until all of the applications are in. We look at first whether students have met those minimum requirements. So that's sort of our first look. And then beyond that, we really look to your CV that you've submitted. So what is your past experiences? How might that contribute to your success in the program? And really, we look at your letters of reference. So all of those are really vital components of your application. So, your transcripts kind of get you potentially in the door by meeting those minimum requirements. And then it's your CV and your letter of intent, as well as your references, that really help us to decide who we think is going to do well and succeed in the program. We do then complete interviews. So we do create a short list for interviews, and those will be held kind of end of January. This year, I think we have them scheduled for, and likely those will all be conducted virtually over Zoom. And then typically around March, we start to send offers for the program, and we do sometimes waves of offers. So that's just something to be aware of. Okay, in terms of the program fees, the first year the fees are $37.80 per term. So again, there's 3 terms in the first year, and then in the second year it's $36.72 per term, and there's 2 terms in the second year. And unfortunately, the rate is higher if you are an international student, but I will let you know that those fees are posted on the McMaster website, and that sometimes they do modify them each year. So sometimes there is a small rate of increase per term. So right now, those are the fees that are listed. So also just to be aware of, as we are in the midst of a global pandemic, there has been lots of challenges that the university has faced in terms of decision making to really ensure the safety of all students, staff, faculty. And McMaster has moved forward with a vaccine mandate. So this is really the requirement for attending on-campus activities or any McMaster affiliated sites. So St. Joseph's Healthcare, because it is also a McMaster affiliated site, but does have its own vaccine mandates as well. So right now, to access McMaster University, all students, staff, faculty must be fully vaccinated, or they must have received an approved vaccine exemption, and then complete rapid antigen testing if they are coming on regularly, if they are coming onto campus. These are the current guidelines. But they are changing as things evolve. So I can't guarantee that next fall that those would be the specific requirements, but they are the requirements right now. I will let you know St. Joseph's Healthcare Hamilton has a vaccine mandate that any new learners, so anybody who will be going on to practicum, must be vaccinated. So they do not provide an alternative. So only those that are vaccinated are able to complete a practicum at that site. So those are just some things to be aware of as you start applying. Again, that's not program specific, but this is actually university mandated. So we don't have any ability to modify these mandates or policies. Everything that I talked about, or a lot of what I talked about, is also highlighted on our website. So I do encourage you to take a look at our website. We are updating it as the program evolves too. So as new courses get designed and approved, those get posted on our website. So I do encourage you to look there. You'll see under the prospective students tab, there is also information like an FAQ, so frequently asked questions tab, that does identify and respond to a lot of questions that we've had in past open houses about the program, as well as being a psychotherapist or what to expect. So I encourage you to take a look at those FAQs as well. Okay, so next I'm going to transition and let two of our current psychotherapy students, so again, second year students, Prabnar and Navya, speak to their experience in the program. So I'm going to stop sharing now and I will let them talk to you.
Thanks, Elizabeth. Hi, everyone. Good evening. My name is Prabnar. I am in my second year, like Elizabeth mentioned. So right nearing the end before we graduate here. And I'm also the president for the GPA, which is a student-run organization. The Graduate Psychotherapy Association is it's a new initiative that the first cohort sort of created to act as a resource really for students to ask questions and to create events where many students can learn not only about psychotherapy, but sort of practice some of our skills for the program itself. But in terms of my experience with the program so far, it really has been a great overall learning experience, especially throughout the pandemic. I think one thing we were really all looking forward to was working through the hospital site, but I think all the instructors and staff and team have really come together to provide a really comprehensive experience online. We've had breakout rooms and organized lectures, standardized patients that we work with. So I think everything that we would have gotten in person, they've done an amazing job transitioning it all online. And we have had some opportunities to come together as cohorts and students to meet one another. So overall, it has been a good experience. And I think that was one of the big things that encouraged me to come to this program specifically, how it is so unique with its a multidisciplinary team effort in terms of not only with the practicum, but the instructors as well. In terms of our practicum experience, I'd say it's been very, very informative. I really appreciated how the first practicum throughout the summer term is completely observational unless you have opportunities to do some therapy. But you really get the chance to just take it easy and really learn from the therapists and the various individuals that are actually doing the interventions, which has been a very, very great opportunity for all of us. But I think overall, a great experience so far. And I'll let Navya continue on to share some of hers.
Thanks, Prabnar. So hi, everyone. My name is Navya, and I'm also in my second year of the program. And I came in right after my undergrad. So I started off in the life sciences program and then specialized in human behavior, which is part of the psychology, neuroscience, and behavior program at McMaster. So McMaster has kind of been home for me for many, many years. And yeah, so a little bit about my experience in the program. I think like with many students, the transition to virtual school can be daunting and a little bit overwhelming, but luckily we were able to do that, I think, very seamlessly. There's lots of opportunities to interact with your classmates. And one thing that really drew me to the program was the smaller class size. And that's something that was very helpful having online school as well, is that you have those opportunities to work in breakout rooms, to actually practice some of those psychotherapy skills inside the classroom and outside. So the GPA, for example, we hold events where we can practice case conceptualizations or role play activities. So lots of different opportunities that way outside of the classroom. And in terms of the program itself and other course experiences, I really liked how it started off foundational. So everyone was on the same page going into our first practicum, which can also be a little bit stressful going into it. But the fact that it was observational and you're working with these professionals that are very familiar with how students interact with them, they really want you to succeed and do well. And so I formed many lovely connections with a lot of different people at St. Joseph's Hospital. And I think that's something that I hope to continue as well. It's great to get that networking side of it, as well as learning a lot of those application skills in psychotherapy. And then in our second year, we've been doing a lot of applied opportunities. So with those standardized patients with each other as well, filming clinical videos and then getting graded on those and just having very open discussions, giving each other feedback. So it's a really great learning environment. A lot of productive conversations come out of it. And yeah, I'm just looking forward to graduating soon and sort of seeing where that takes us next. And Prabhner and I, as well as the Graduate Psychotherapy Association, is happy to address any questions specific to the student experience. So you can find us on social media for that. But thanks all for being here. And yeah, I guess I'll hand it back to you, Elizabeth.
Thanks very much to both of you. It's always nice to hear your perspectives in the program. And having been our first year, I know there was probably even uncertainty entering into the program, and hopefully we've met those expectations. I know, it's been really wonderful having your cohort, and really it's been such a nice working experience. So thanks very much for your time tonight.